There are 5 important warning signs that you should never ignore. And out of these 5 early symptoms, there is always at least one that people think is normal. So today, I am making this video just to tell you that you must not overlook these 5 symptoms, because if you detect them in time, something can be done about them. Sometimes when you go to your primary doctor due to some illness, at that time only the symptoms are managed. You are told that you have high blood pressure, and the reason might be this or that. You are given medication for high cholesterol or told to take pills for arthritis. But I have always been more interested in the underlying root cause. What is actually causing this illness? So I have made these 5 points for you. Let's start with number 1, chronic fatigue. You constantly feel tired all the time, and this tiredness can be due to many different reasons. If it is anemia, it could be caused by low B12 or low iron. People often ask, "Doctor, do I have a vitamin deficiency? Or can you suggest a vitamin that will get rid of this fatigue?" So through this video, I want to tell you that vitamins do not work to treat any symptom until you correct your diet, because if you are already getting proper nutrition from food, you might not even need to take any vitamin supplements. A lot of people don't even consume the basic amount of protein their body needs every day. They don't complete their protein intake, and I've seen cases where simply adding a little more protein to breakfast solved their problem. Another reason can be a deficiency of vitamin B1. If the body's vitamin B level is low, you will suffer from mental stress, racing thoughts while trying to sleep, overthinking, restless leg syndrome where you constantly shake your legs due to anxiety, and increased nervousness overall. This fatigue could also be due to a tick bite. People who live close to animals, those working with livestock or farmers, can be bitten by tiny insects that live on animal skin, and the germs they inject into the body weaken the vitamin D receptors, meaning your body's cells cannot use vitamin D properly. If you have liver problems, heart disease, or any autoimmune condition like arthritis, psoriasis, or thyroid disorder, your body develops high inflammation, which results in fatigue. Number 2 is sudden weight loss. There can be several causes for this. It could be hyperthyroidism, where the thyroid gland becomes overactive and causes weight loss. Similarly, type 1 diabetes can lead to sudden weight reduction. There is also a condition of the adrenal glands called Addison's disease, where adrenal function slows down or stops, leading to weight loss, or even parasitic infections in the stomach can cause this. Number 3 is persistent weakness, physical weakness that has been there for a long time and isn't improving. This could be due to iron deficiency, meaning you might be anemic, or low sodium in the body could also be a cause. Low sodium levels lead to weakness. Similarly, if your body lacks magnesium, vitamin E, or potassium, that too can result in physical weakness. Number 4 is chronic diarrhea. If you have had loose motions for a long time, if your stomach is upset and diarrhea doesn't stop, this could be a sign of food poisoning, meaning you are eating something your body is not accepting. Or it could be due to low zinc levels, since diarrhea is a symptom of zinc deficiency. In many cases, chronic diarrhea is also caused by side effects of medications, so you should consider that too. Many people also have irritable bowel syndrome, which gets worse if you eat grains daily like wheat or products made from flour such as bread, pasta, oatmeal, or semolina, because these contain high fiber, which should be avoided in IBS since fiber triggers diarrhea. Also, if you travel frequently to different countries, parasitic infections could be a cause leading to diarrhea, and in such cases, you should take more probiotics. Number 5 is persistent stomach or abdominal pain that lasts a long time. For this, I would first tell you to eat whole foods and avoid junk food, because just by doing that, 95% of your problem will be solved. Stop eating outside food and eat homemade meals. If the pain still doesn't go away, then there could be other reasons like gallstones or kidney stones, but you won't know until you get an ultrasound or some other tests done. There is also a condition called SIBO, in which the number of harmful bacteria in the small intestine increases and produces excessive gas. In this case, increase your garlic intake and follow intermittent fasting. Or it could even be appendicitis, parasitic infection, ulcer, or gallbladder sludge in which the bile starts to thicken, and due to blockage it flows backward instead of moving forward, causing inflammation in the pancreas, which is called pancreatitis. So the first step you should take is to remove foods from your diet that thicken the bile, such as refined cooking oils, deep-fried foods, and dairy products. Second, you should include nutrients in your diet that support the liver, such as choline, omega-3, fish oil, and lemon water. These things will thin the bile and solve the problem. In rare cases, it could even be cancer, so never ignore these symptoms. I myself didn't know much about nutrition and food before, but now I spend most of my time studying it. And it's also possible that when you tell these symptoms to your doctor, they might say it's all in your head and dismiss it, so you should visit another doctor and double check. Similarly, when you are given a prescription or a treatment plan, you should ask whether this treatment will actually fix the root cause of the illness or just suppress the symptoms. Because if it's the latter, then this illness is going to stay for a long time, and you should be mentally prepared for that. I hope I was able to answer some of your questions in this video. Take care of yourself.